All right, so today is part two of our series. Last time we talked about early psychosis, kind of basics and breaking the stigma in early psychosis. And so today we'll do a little bit of reminder of some of the basic information on early psychosis, but we really want to focus on some practical strategies for families and other supportive folks to use in order to help support young people who might be experiencing psychosis. So I'm going to hand it over to Will to talk about some background on psychosis.
Thanks, Laura. So importantly, psychosis is not a diagnosis in and of itself. Rather, it's an umbrella term that describes a set of experiences in which people have difficulty telling what's real and what's not real. So psychosis can include disturbances in perception, known as hallucinations. They could also include unusual or rigid beliefs that are out of sync with how others think about the world, referred to as delusions. They may also include disorganized speech or thought patterns, which we often refer to as thought disorder. Psychosis is a lot more common than you might think. So in fact, 3 in every 100 people will experience psychosis at some point in their lifetime. And psychosis doesn't discriminate. It can impact any race, gender, sexual orientation, religion, socioeconomic class, etc. Psychosis typically develops in adolescence and young adulthood, so between ages 16 and 35. Onset tends to be a little bit earlier in young men compared to women, and the peak age of incidence is around 21 years old. And that's kind of the age group that we're focusing on today. When we say first episode psychosis, we simply refer to the first time that someone experiences psychotic symptoms or a psychotic episode. And, importantly, people experiencing a first episode may not understand what's happening. The symptoms can be highly disturbing and unfamiliar and can leave the person feeling confused and distressed. And similar for family members. Family members or their loved ones often feel bewildered at what's going on, especially during this first episode. In that step, we're aiming to focus on a first episode of schizophrenia, but there's lots of possible causes of psychosis. Remembering that psychosis itself is not a diagnosis, but rather a way of describing experiences that deal with difficulty in reality testing. So there's lots of possible causes, right? Psychosis can occur in extreme states, such as extreme sensory deprivation or lack of sleep. If anyone goes without sleep for a couple of days, you might start to hear things that aren't there, see things that aren't there, et cetera, have disorganized thinking. Most commonly, however, psychosis can appear in the context of mental illnesses, such as schizophrenia, schizoaffective disorder, and mood disorders like bipolar depression. It's more rare, but psychosis can also be secondary to medical conditions, such as Parkinson's disease, epilepsy, or brain tumor. Finally, psychosis can occur when someone is acutely intoxicated on a substance. So this can include cannabis, stimulants, and psychedelics like LSD or psilocybin, et cetera. And importantly, because there's so many different causes of psychosis, diagnostic ambiguity and uncertainty is an expected part of first episode treatment. So it's not always clear what's causing someone to experience psychosis. But we're going to move now into a little bit more about communication strategies that you can use to kind of build an alliance with a young person that's experiencing psychosis. And so we think that something that's really helpful to kind of start with is thinking about the way that vulnerability to psychosis might interact with environmental stressors. And so this can be a really helpful starting place to kind of come to a shared understanding of the way that psychotic symptoms may emerge in this young person's life. And so when we talk about these things, we often like to use this metaphor, which we call the stress bucket. You can think about all of us having buckets, which kind of represent our capacity to manage and handle stress. Some of us might have larger buckets that can hold a lot of stress, a lot of water dumping into them. And some of us may also have holes that are poked into our buckets that allow the stress to flow out. And these could be coping strategies, things like that. Other people might have a smaller bucket. A bucket that overflows a little bit faster. And they might not have holes that is like kind of letting that stress escape. And so we can think about that overflow, when the bucket fills up and the water starts to overflow over the top. We can think about that as the emergence of symptoms, in this case, symptoms of psychosis. Diving that into this kind of metaphor in a little bit more detail, everybody has a bucket, right? And you can't necessarily control the size of your bucket, which is kind of representing vulnerability to psychosis, right? And this could be related to genetics, birth complications, early adverse experiences or trauma. We can also think about the different stressors that are going into that bucket, right? So this could look like stress within relationships, stress at home, in communication, stressful communication. This could look like major life transitions to college, et cetera, school or work, loss or death of loved ones, drugs, finances, discrimination. And I think something that's really important to think about here when we're kind of like having this conversation with young people who might be experiencing psychosis is, what does it look like when your bucket overflows, right? What are some of those warning signs that you're kind of reaching your capacity? And so for me, for example, something that I always notice when my bucket's starting to get full is that I'm usually a pretty even-keeled, easygoing person. But when I can feel that the water's starting to rise in my bucket, I'll get a little bit more irritable, or like a little like snippier with, especially like with loved ones or close people. And so that's usually a sign to me to kind of check in with the holes in my bucket and figure out ways to kind of drain that stress a little bit. It's one of those early warning signs. And so I think thinking about what that overflow process looks like can be really helpful to start to figure out how to address that and how to kind of poke some more of those holes in the bucket. And so those holes we can think of as, stress relievers, things that help that stress drain out of the bucket. And so this could look like all sorts of different things. It could be coping skills. This could be, attending therapy. Taking medications is obviously a really important one in this context. Sleep, nutrition, exercise, structure, and then of course, really importantly, social support. And that includes, family support.
Thank you, Will, for walking us through that. Yeah, I find that metaphor just a really normalizing way to talk about the experiences of stress, right? At STEP, when we're talking about this as providers, we use this metaphor as well. But whatever a young person is labeling their experiences, I'm not there to debate with them what it's about. But if they're referring to it as my stress or my episode, my depression, I want to use whatever language they're coming in with. It's not about what's the right label for something, but really identifying what it is that they recognize that it looks like when their bucket starts to overflow, and really using that language. And regardless if we're someone who experiences psychosis or not, we all have stress buckets and ways that we look when things start to overflow for us. I wanted to transition a little bit to thinking about the role of families. In our audience today, we've got folks coming from varying backgrounds. Some of you might be family members of young people who are experiencing psychosis, and you might be at various points in that journey. Perhaps you're a parent of someone who's been newly diagnosed. Perhaps you're someone who's desperate to try to connect your loved one to care. Or maybe you're just an interested community member or provider looking to learn more, to understand more about this experience. So whatever brings you here tonight, we do hope that this can, some of these strategies will be helpful for you. Thinking specifically about the role of families, it's important to recognize that 85% of young people who are experiencing psychosis are living at home and relying on families for various forms of support, whether that be emotional, financial, or social. So families can have such an important impact on recovery and are such key players in folks' recovery journeys. The good news is that when families are actively involved, they have the ability to positively impact recovery in various ways. Folks with involved families tend to experience better access to care, better outcomes in treatment. So studies have shown that clients have better outcomes with family treatment than with individual treatment alone. Long-term family engagement actually reduces relapse rates of psychosis 20 to 50% more than medication alone. Folks tend to have fewer hospitalizations, less intensive interventions when they do need interventions, and overall improved quality of life. So as if there wasn't reason enough, there's just a lot of research and support, and even anecdotally to get behind the positive impact that family members can have. And with all that being said, we certainly recognize that it can be really challenging to be supportive at times of someone experiencing psychosis, especially when that young person may or may not be interested in treatment, or perhaps is experiencing minimal insight. And when you're potentially facing countless other demands as a parent, caregiver, someone who's working in all the different roles in your life. So we just want to try to inform you and empower you with various strategies that might help you in supporting your loved one's recovery and hopefully reducing some stress at home. So some general strategies, right? As I mentioned, identify, access, and support engagement and treatment. Maybe that's finding the place for your young person to go. I know that doesn't necessarily mean that they'll want to necessarily engage or accept it, but eliminating some of the barriers to the best of your ability. Maybe that's a practical way of helping provide a ride or reminding them of appointments, just any ways to kind of help improve that access. You can encourage their medication decisions. As Will mentioned, that often is a big hole that we can poke in that stress bucket to help alleviate symptoms of psychosis. Can learn to recognize early warning signs and symptoms. So a lot of time, sometimes we have young people report, no, like, the symptoms just came out of nowhere, went from 0 to 60, or that's what it feels like. And sometimes that can be the case, a really acute onset of symptoms of psychosis. But a lot of times there can be early warning signs that are there. And so learning what those are for your young person, what it looks like when their bucket starts to boil over, and helping bring their awareness to that, and or communicating with a treatment team if they're involved and say, hey, I just want you to know I'm seeing this at home. Want to make sure that you're aware that this is an observation I'm having for for my young person. It can help your loved one learn to manage stress and encourage their coping. So if you're aware of something they're working on, or have an idea for maybe a healthy coping strategy, you can kind of ask them permission if you might be able to offer that to them, and maybe demonstrate it, or reinforce strategies that they're working on. Encouraging healthy habits, nutrition, sleep. A big one is discouraging substance use, right? Especially cannabis. We know with the legalization of cannabis in many states across the country, including in Connecticut, other family members, you yourself, other folks in the home might be using cannabis. It's very common amongst our young people, but we know that the relationship between cannabis and psychosis is something that we really want to minimize use, because cannabis use can really exacerbate symptoms and impede recovery in many ways. So trying to discourage that, and if that means cutting back or limiting access yourself to kind of help model or support your young person, that's something that we would also encourage. Overall, trying to decrease stress in the home, keeping or reestablishing family routines. Maybe a young person experiencing a first episode psychosis can really uproot intense, scary, traumatic experience for the family that really changes things, or brings a young person back home who was previously at college for a while. Trying to find ways to kind of bring back some normalcy, reestablish some typical family patterns can be helpful. And amidst all of this, it's important to celebrate progress, right? Any small steps, it's important to recognize, both for your loved one and for yourself. That really helps with holding on to hope. Remembering that recovery in psychosis is the expectation, not the exception. We expect, especially with early and effective treatment for young people, to kind of get back to the important roles and values and goals in their lives, and be able to experience recovery and have rich and meaningful lives. So holding on to that hope for your young person, and as your providers, we certainly will try to help encourage that hope for both you and the young person. I want to share some specifics about what we know about folks experiencing psychosis. We know that they might be particularly sensitive and responsive to displays of warmth, structure, and support. Also sensitive and to critical comments. So although often well-intentioned, over-involvement or kind of doing too much can actually be really overwhelming at times for a young person. So we want to be mindful of that too. Maybe asking them, does this feel overwhelming to you? Or does this feel helpful, right? There's always ways to try to get some feedback on kind of what we're doing and the ways that we're trying to support. And there's no one perfect way, but kind of being open to adjusting our path is an important trait. Complex and unclear communication can be challenging. So we'll talk a little bit about trying to keep things simple if that's what's needed, kind of concrete, clear instructions. Because if we're experiencing psychosis, or, the aspects of thought disorder, it can be really hard to process complex communication. This doesn't mean that someone experiencing psychosis is not going to be able to understand or engage in conversations, but particularly maybe early on, if this is coming up for your young person, it's helpful to adjust. You want to keep these things in mind, those kind of general principles about warmth and criticism and over-involvement, as we talk about some additional strategies. A lot of times I have parents asking me, what do we do? How do I get through to my young person? And we will talk about specific things and ways of talking, but I want to emphasize that focusing on the relationship is really important. Just like it is therapeutically, parent-adolescent or young person relationship is an essential piece in supporting your loved one's recovery. Although as a family member, you have much more rapport than, say, myself as a clinician, we also recognize that you've got a lot more history to work through at times too. So things can be complicated. And I recognize that some folks in the audience right now might be thinking, well, shoot, we are in such a rough place right now, whether it's due to psychosis or other factors, and that's okay, right? There's hope to start to change the dynamic and strengthen your relationship. Some ways to do that and things that you can always fall back on are what we call befriending type skills, which is kind of just what it sounds like when you're trying to be friendly, you're trying to make a friend. You want to be kind of positive, supportive, offer companionship. This might look like highlighting your loved one's strengths, like really being sure to notice the positives in them. It's so easy for our minds to go to all the things that we think are going wrong or that we want to change or that we're worried about that we forget to highlight and emphasize the positive. Try to talk about shared interest. It doesn't have to be about their mental health. Research shows that it can be helpful to kind of do some reminiscing and talking about positive memories. A lot of times that might include memories of pets or family vacations, if that's something that your family's been able to do, or special trips, just moments of connection to kind of look back on, highlight, try to bring both of you kind of back to that place where there were moments of connection and positivity. Kind of out of this, you hope to start to develop some shared goals. I might, as a parent, or might have a thought that I want you in treatment and I want you on medication, or I want all of these things. That might not be what the young person wants, but okay, we can both agree that we want to keep you out of the hospital, or we really want to support you getting back to school or work. Great. That's a starting point. That's developing a shared goal. And just like as we would do in therapy, then we start thinking about, okay, how can we take small steps to get there? Additional things to think about is a skill of what we call engaging in curious questioning, but try to be curious and non-judgmental, right? We can do that by asking open-ended questions, showing interest, trying not to make assumptions, almost pretending like you don't know your young person as well as you do, not making any assumptions about them, but just genuinely asking like, tell me more about that. Or like, why do you think that way? Or help me understand that. This involves using a lot of active listening, reflections, and if you're trying to use these skills, it's important to be checking in with your loved one if you're engaging in conversation with them. So make sure you're getting it right. Like maybe you try to reflect or summarize what you thought they said, but check in. Did I get that right? Or is it okay that I'm asking these questions? Right? Oftentimes, and I'm guilty of this myself, and many parents, they're just eager to help and be involved and understand. And so maybe they're asking question after question, and it might be overwhelming to a young person. So we want to be mindful of what we're doing and the impact that we might be having. And sometimes the best way to do that is to ask for direct feedback. And if we notice that someone's feeling distressed, right, just call a timeout. Okay, like it seems like you might be feeling overwhelmed, or I might be getting too into this. Like, maybe we can come back to this later. We don't want to directly challenge delusions or fix false beliefs, but we also don't want to collude with psychosis. So we talk a lot about validating feelings, being empathetic. We'll talk through some more examples of this. But again, someone saying, maybe, gosh, the FBI is following me. This is, I don't know what to do, that they're right there. You don't have to kind of get into that content with them, or you in your mind, you know that that's not the case perhaps, but you can still validate the underlying feelings. Wow, that sounds really scary or unnerving, right? So there I'm offering connection, validation. I'm not saying I agree with what they're saying, but I'm also not saying, no, you're wrong, you're crazy, what you're saying doesn't make sense. It's important that when we're engaging in this curious questioning, that we're open to different explanations and experiences, right? We might come into a conversation, as many of us do, with a set way of how we think it should go or what we think the right answer is, but being open that there could be multiple perspectives and explanations for things. We want our young people that we're working with or engaging with to be open to our perspective or different perspectives. So we also have to show and model that as well. And then lastly, it's helpful to connect and normalize, right? You don't want to say, if you're not someone with lived experience of psychosis, you don't want to say, oh, I totally understand what it's like to hear voices, or et cetera. I totally get it. That can be invalidating, but selective use of personal disclosure, like, wow, like if I would be scared too if I felt like the FBI was following me. That makes sense that you feel that way, right? You're connecting, you're normalizing the feelings and some of the responses that folks are having. So now I'm going to hand it back over to Will to talk through some examples of validation.
Yes, there's a lot of different ways of kind of coming at validation. And I think that the central goal is to help your young person feel listened to and like their feelings are valid. Right off the bat, paying attention and listening in and of themselves, that is validating. Just being present, making eye contact if that feels comfortable, nodding, doing those active listening skills, right? Really helps someone feel like you're there with them. I also think it's important to note that, as Laura's kind of saying, the feelings are always valid, even if you don't agree with the content. I can see how you'd feel that way. I can imagine how that might feel. So I think that is a really important technique to think about here is when you're feeling lost, go find the feelings and don't get stuck on the content necessarily. I think a helpful strategy to do this is just try to imagine what it might feel like. If you were convinced that someone was following you or reading your mind, et cetera, what are some emotions that might come up for you? That sounds really difficult. That sounds really upsetting. That sounds like a violation of your privacy. All those type of things are great ways to try to connect over that. And one really simple strategy for validation that we use a lot as clinicians and that also can work as a loved one or a parent is using reflections. So kind of reflecting back what you're hearing to the person. So these could be extremely simple, so just mirroring back to what your young person is saying to you to let them know that you've heard them. So I'm hearing you say that you're worried that people are out to get you. Just repeating back kind of what you're hearing. These could be kind of involve taking an educated guess about the emotion that your young person might be experiencing. So I imagine that might feel scary, overwhelming, hard, etc. And they could also get more complex, where you kind of take a guess at what your young person might mean, but might not be directly saying. So I imagine it might feel stressful to be in public right now if you feel that way. Do you want to go somewhere else or somewhere less crowded for a bit? And so all of these techniques are different ways that you can kind of help someone feel validated and feel heard. Thinking about that last example, do you want to go somewhere else? It's kind of starting to think about a solution. That leads us to this idea that we call the righting reflex, which is essentially this impulse to relieve another person's suffering by fixing their problems or pointing out solutions. And so this is an impulse that I'm sure that we've all felt at some point, right? Where we want so badly to solve a problem for someone that we jump right to providing solutions or trying to problem solve. And so why do we often jump to this? The answer is very simple. It's hard to see people that we love struggle, feel upset, or do things that could negatively impact their physical or mental health, and we want to help. And I think that the term reflex is very appropriate because we often do this without even thinking. And so what's wrong with this? Sometimes nothing at all. And sometimes it can be helpful to jump right into problem solving. Other times, however, it can lead to conflict, as it might make your young person feel like you aren't listening to their experience or hearing how they actually feel about it. And so it can be useful to sometimes slow this down a bit, right? So you can use these validation techniques that we discussed in that last slide. And a really powerful thing that you can do here to help slow this down is simply to ask for permission before sharing advice or problem solving. So just asking something like, would it be helpful to think about solutions right now, or would you rather that I just listen? And that can kind of give the young person agency in deciding whether they want help and kind of jumping to solutions, or whether they want you just to be there for them.
Right. Great. So we've outlined, some general principles, and now we want to get into implement those strategies a little bit more and give you some more examples. And I just want to remind everyone that we're sharing some principles, right? Like these are core tenets to what we do therapeutically. And so we're not suggesting that loved ones or family members need to take on the role of replacing therapists, but we also want to empower families and loved ones to be able to kind of use some of these skills. We're not saying that, treatment teams aren't necessary, or that we're trying to put, additional burden on families and loved ones, but really looking for that empowerment. So now thinking about how to put some of these strategies into practice for common scenarios. Tips for communicating with someone experiencing psychosis. Many folks experiencing psychosis, especially when actively experiencing positive symptoms, remember those are things like hallucinations, paranoia, delusional thoughts, they might have difficulty concentrating. And so it's important to remember to try to keep your statement short, take one point at a time, don't give too many choices at once, and not being afraid to adjust things, right? Just as if someone was experiencing difficulty learning something at school, we wouldn't say they need to just figure it out, right? We would try to find ways to accommodate them. So utilizing written reminders or other memory aids, trying to offer guiding questions to help them kind of sort through things. What's the first step? How would you begin? So just some general tips on how to be helpful in this scenario. Another common scenario would be trying to communicate with someone who is expressing delusional beliefs and they're 100% convinced of them. All right, so remember, we've gone through some of this, but remember to not get pulled into an argument. Try not to say, stigmatizing and validating things like you're crazy or that's not happening. Because remember, we have to accept that this is someone's reality, that to the person experiencing these symptoms or psychosis feels very real to them. So be true to yourself, that you might say, I can't see them, but I know you can. Remembering that we might want to redirect, but we want to help the person feel heard, safe, potentially direct them to something that might be calming. But, overall, just your goal is to try to keep emotions cool and calm, keep stress low. For some of these scenarios that we're going to act out, let's imagine that we've got a young male college student. They're experiencing some paranoia. They're convinced someone is monitoring or following them. They might actually also be hearing voices and maybe having some ideas of reference where they're seeing things in their environment that they think are especially for them. For this first scenario, we're going to give you a little demonstration of an interaction that is not going great. And then we'll show you ways to maybe alter it to make it a little bit better.
Mom, I can't take this anymore. They're everywhere. They're tracking everything.
Here we go again. No one is tracking you. When are you going to give this up?
You're wrong. You have no idea what you're talking about. They're telling me right now that they know the truth. Can you not hear that?
No one else is here. It's all in your head. You just need to take your medicine. That's the end of that interaction. As you can imagine, this type of interaction with its intense emotional tone is likely to be perceived as less supportive, lead to more conflict, perhaps even, increase stress and maybe even exacerbate symptoms. We need to remember that parents and caregivers are human, and this can be very challenging to be supportive and know how to respond to someone who's experiencing active experiences of psychosis. So if you felt like that resonated with you, or you've heard those words come out of your mouth, that's okay. It's not uncommon, but now we're going to show you some ways to tweak it so you can improve this type of interaction. So I guess take 2.
Mom, I can't take this anymore. They're everywhere. They're tracking.
That seems overwhelming. I imagine it might feel very scary and like an invasion of privacy to feel like you're being tracked.
Yes, exactly. I feel so exposed. They're telling me right now that they know the truth. Can't you hear that?
You feel really vulnerable. And I can't hear that right now, but I know you can.
Yeah, I can hear it loud and clear. I wish I could just get away.
You want some relief. Is there anything that can help you feel safe right now or that you think would be helpful?
I don't know. I can't think.
Okay. Would it be okay if I make a suggestion?
I guess.
Maybe we could try to do something distracting, like go listen to some music or take the dog out in the backyard. So that's the end of that. In that demonstration, right, you notice the difference. The parent calmly tries to validate and reflect. They don't collude or say they agree with that they can hear the voices when they can't, but they really focus on keeping the emotional temperature cool. You might notice that they ask permission before offering a solution or a suggestion. And we don't know how it turned out, but they offered some suggestions that might relieve stress. In this case, it would be if someone is experiencing or expressing delusional beliefs, but they've previously been open to discussing them with you. And so I wouldn't really recommend this for the first time that you're talking to your loved one about a delusional belief, but certainly if you've already done some, listening and validating, and they've showed an openness to it, this might be a technique that you might be able to use.
This keeps happening. They're everywhere. They're tracking everything.
That seems overwhelming. I imagine it might feel very scary and like an invasion of privacy to feel like you're being tracked. Am I getting that right?
Yes, exactly. I feel so exposed and it's distracting.
That must be so uncomfortable. I'm curious. How do you know that they were there?
Well, I could see them following me home from the bus stop on my way home from class.
Hmm. Help me understand. What did you see?
A lot of things. The guy across the street from me kept touching his ear. There were a couple of red cars in a row. I just had this like feeling.
That sounds like a lot.
Yeah.
I just want to understand how this is all affecting you. Is it okay that I'm asking all these questions?
Yeah, it's okay. I mean, it's nice to know that you want to know, because sometimes I feel like I'm not like supposed to talk about this stuff.
Hmm. No, I really appreciate you sharing with me. I do want to know. I'm curious. What did you make of the guy touching his ear?
Well, it was a sign. He was probably communicating with the red cars or something. I don't know. I just felt like he was in on it or something. I don't know.
You felt like it was a sign. I wonder, any chance him touching his ear could have been something else?
Like what?
I don't know. I wasn't there, so like I can't know for sure. But maybe he had an itch or like was fixing his headphones or tucking his hair behind his head.
Yeah, I guess I hadn't thought of all those things, but I don't know though, because all the red cars were there too. So I'm not sure.
Yeah, it just a thought. Thanks for hearing me out. So that's the end of that scene. So this role play was a little bit more advanced. And it demonstrated a situation in which the young person was not as acutely distressed as our first scenario, right? Like they weren't coming in as distressed. The parent was able to calmly validate and then engage in some curious questioning. Note that the parent asked a lot of open-ended questions, asked permission and checks in with the young person throughout the interaction. And then only after lots of validating and understanding, attempts to support the young person in generating some alternative explanations. If this is the first time you're hearing any of this stuff, I don't expect folks to be experts in this. This is a cognitive behavioral therapy for psychosis skill, trying to increase flexibility in thinking by generating alternatives. And so it's something we use as therapists, but it's something that it has been shown that, with practice and support and a relationship, parents and loved ones can be empowered to try to dive into a little bit. Another common situation that families talk with us a lot about is if the person's behavior is appearing unmotivated or inactive. So first, remembering that folks experiencing psychosis are often impacted by negative symptoms, or experiences of depression, or even medication side effects that could possibly slow them down or make them more sleepy than usual. So it's important that we kind of alter any misconceptions that young people are just being lazy, and recognizing that there, could be very real reasons kind of driving some of this behavior. A little bit about that, some folks with psychosis might experience difficulty with what we call anticipatory pleasure. So that means like anticipating or expecting that something might be enjoyable. But research actually shows that there are no differences in actually experiencing pleasure when you're in the activity, or consummatory pleasure. So basically, this translates to folks might need a lot of probing and support from family to encourage them to engage in things, because for some people in their minds, it's telling them this isn't going to be worth it, this isn't going to be fun. But when they actually start experiencing it or engaging in the activity, they can experience just as much pleasure as anyone else. Things to think about: encouraging pleasant events, whether that's just going to get a coffee or a nice treat, or something simple activities like going for a walk, listening to music. Daily routines can be really helpful. And as like we would want to do with like kind of any young person or anyone trying to work towards a goal, focus on and praise effort, right? Not necessarily outcome. I can see you're working really hard on your goals, not that, oh wow, you achieved it, you got that A in your class. Wow, I see that you're putting a lot of effort into studying or searching for jobs. It's not all about, oh, you got the job, that's when I'm going to praise you, right? We want to reinforce the process. Will and I will do another scenario. And so for this situation, try to imagine a young person who might be, struggling to leave their room, having a hard time engaging with family. Hey, I just wanted to check in and remind you about our family outing later.
Uh, I don't feel up for it. It's too much effort.
You're feeling like it would be too much, huh?
Yeah.
Well, all right. Well, remember last time we all went up to Sleeping Giant together. I loved how you helped carry your little sister to the top. That was so sweet and thoughtful of you. Seemed like you really enjoyed yourself.
Yeah. No, it was a pretty cool view. I don't think this time will be any fun.
Yeah, I hear you. I get that it can be hard to get up and do things when you don't feel like it'll be any fun.
Yeah, it really is.
Well, I want you to know we're leaving at 12. We'd all love to have you join. And just know that if we get there and you aren't feeling it, totally okay to kind of head back to the car. End of that scene, right? We don't know which direction it goes in. But in this role play, you can see that the parent attempted to engage and prompt the young person in existing family routines and rituals, right? Family outing on the weekend. They used reflective statements. They even thought about some of that like relationship building piece of reminiscing over positive memories, right? By talking about the time when they all went together and it was really nice. And then also recognizing the potential limits of negative symptoms, right? That difficulty with anticipatory pleasure. There was no blaming or calling them lazy, just encouraging the young person to join, but also giving them options, right? You can only do so much, but making sure that we're kind of not giving up or not even asking, right? Making sure that the offer is still there and really trying to kind of help and encourage. If someone's behavior is frightening to you, just some reminders to kind of give that person space physically. You can move gently to a quieter, more open space. Don't crowd or rush the person. Try to speak and act calmly. Ask them for what might help. Clearly communicate if they're doing something that you're concerned about. Stop, please. If there are warning signs of a relapse, you can reassure them, I'm trying to get help. And of course, if there are threats, take them seriously and try to get help by calling for support. So here are just some phrases. Again, these slides are available on our website if you want to use them later for reference, but for navigating intense interactions, right? These thoughts or feelings, experiences are really intense. I'm wondering if we should try to focus on something else for a little bit, right? There, we're trying to redirect. We're not getting caught up or pulled into an argument or conversation. You know what? I feel like I'm making things worse or more difficult right now. I'm going to step away. I notice that we're both really upset right now. Let's come back to this later, right? There's no use in kind of pushing when the situation's already escalated or emotionally hot, or if someone's acutely distressed by a lot of active experiences. That's not the time to try to generate alternatives or do other things. It's really just to try to not make the situation worse and de-escalate if we can. Can always agree to disagree. And if we are concerned, I'm concerned about your safety. I'm going to get help. The last thing I wanted to walk us through is if things are escalated, we feel like the situation, we need additional support from first responders like police, a mobile crisis clinician, ambulance due to an acute safety concern. These are some tips to kind of think about that situation of kind of how to call and what communication, what information to communicate. I'll walk us through an example of this, but when calling 911 or 211, I've got concern that my loved one is having a mental health crisis and I need assistance. The more information you can give, the better. Sometimes folks are hesitant to share, but it is helpful to kind of empower the first responders to let them know that your young person might, is experiencing psychosis and what it looks like. If appropriate, you might want to request a mobile crisis team. This would include, trained clinicians, and the operator is going to make the decision about whether or not that's appropriate or whether police or ambulance need to immediately come. Oftentimes, all of the folks are involved, but sometimes a mobile crisis clinician, like a trained social worker or something, can be the first person that can be helping respond to or interact. As I mentioned, try to provide helpful information to the dispatcher and any concerns you have about the situation. And then it's important that, be prepared that you might have to repeat this information once someone arrives on scene to support you. So I'm just going to walk through. It's only going to be kind of one-sided, but what I would, say if I'm calling for an emergency response. Hi, this is Laura Sykes. I live at 34 Park Street. My daughter is currently experiencing a mental health crisis and we're requesting assistance. She has a diagnosis of schizophrenia and she's currently unmedicated. She's currently very paranoid and she's actively hearing voices telling her to hurt herself. Right now, she's pacing back and forth inside of our house, and I'm concerned for her safety. Is there a mobile crisis team and or a CIT trained officer available to come to the home? And I just want you to know she doesn't have any access to any type of weapons. There are no weapons or firearms in the house. She's never had any history of being aggressive. So that could, of course, look a lot of different ways. It's hard to be calm in a moment of crisis, but the main things to hit on is like mentioning, mental health crisis, trying to say, I want a mobile crisis team, a CIT trained officer. That won't always be able to be the case. Explaining what is going on, letting them know any history and concerns you have. We'll have a whole other STEP family and community workshop that's about navigating mobile crisis interventions, where we have a panel that kind of comes to speak with you all. It would include mobile crisis clinicians, CIT officers, and other representatives. So we can go into this in much more depth, and the timing on that's TBD. That is what we have for you. Just letting you know that our website has a lot of these resources. It has kind of a cheat sheet of a lot of these slides, kind of how to communicate with someone who's experiencing psychosis. So I encourage you to download that, print it out, maybe have it handy if this is something that's relevant to your life.